Welcome. My name is Kim. I'm one of the nurse practitioners you may meet at one of your upcoming visits. In this video, I'll review common symptoms in the first trimester and when to call if you need more advice. Some of the most common first trimester symptoms are listed here. Most of these symptoms are blamed on the hormonal and physiological changes as your body prepares to make a baby. Although bothersome, they're not a sign that something is wrong and are not harmful to your baby. If you've been pregnant before, you may notice some of your symptoms are similar, or maybe it's completely different this time. This is not unusual. Each pregnancy is unique, so you can expect to notice some differences. And don't worry if you're not experiencing any of these symptoms. That's not a sign something is wrong. The fact that you have missed your period and have had a positive pregnancy test is a very good sign you're pregnant. If you're experiencing tender breasts, consider wearing a sports bra, something without wires. It may be helpful for you to sleep in a soft bra at night. Increased urination without pain is common. We'll check your urine at your first visit to rule out an infection. Fatigue is also very common. You may find yourself needing to take afternoon naps. As your uterus begins to grow, it's normal to feel low-grade menstrual-like cramping. Cramping in the pelvis and abdomen can also be due to hormones which cause your bowel habits to change. Some women start to note constipation or diarrhea, or a mix of both. Gas can also cause cramping. Another cramp you might notice is caused by a tug on one of the 3 sets of ligaments attached to your uterus. The bottom ligament is called the round ligament. As your uterus grows, the ligament stretches. Round ligament pain is described as a short-lived, sharp stabbing pain that only lasts for just a few seconds and is triggered by a movement, like you coughed, sneezed, stood up, sat down, you roll over. If your pains are constant, persistent, and worrisome and are not relieved within a few minutes by shifting positions, please contact our office. You may notice changes to your bowel habits and increased gas. Constipation is common. You may want to start taking a fiber supplement daily and increase fluids to keep your stool soft. Exercise can keep things moving, so consider going for a walk each day. Some women have the opposite issue and experience looser stools. If this is you, make sure you stay well hydrated. Heartburn can occur on and off throughout each trimester. Eating small, frequent meals instead of one big meal 3 times a day is helpful. Avoid spicy and fatty foods, and it's okay to take Tums or Maalox as directed on the label. To find a list of safe medications to take for constipation, heartburn, or gas, you can find them in the Circle by Swedish app. Be sure to download this app if you haven't already. And lastly on this slide, I'd like to cover vaginal spotting. There are times when small amounts of vaginal spotting can occur, like after sex, or when you bear down to have a bowel movement, or you've been lifting some heavy boxes or doing some high impact activities. Anytime you have worrisome bleeding, please contact our office. We'd like to make sure that what you're experiencing is common, and if not, we'll have you come into our clinic. Nausea and vomiting gets a whole slide to itself, as it's one of the most disruptive symptoms in early pregnancy. The cause isn't clearly understood, and as awful as it can feel, the good news is that it doesn't cause harm to your pregnancy. For those of you that feel this way, it probably started before the 9th week. It'll be gone, hopefully, by the time you hit 12 to 16 weeks along. If nausea and vomiting occurs after the 9th week for the first time, it might be due to another condition like heartburn. Nausea, vomiting, and even retching may keep you away from work and the activities you enjoy, so treatment in the early stages is highly recommended. Even if you haven't had your first appointment with us yet, don't be afraid to try some of the suggestions below. Eating small, frequent, high-protein snacks is one of the most beneficial tricks. Instead of eating 3 big meals a day, break up your meals into hourly or every other hour snacks. The goal is to prevent an empty stomach. Even eating 2 bites of a cracker or a spoonful of peanut butter is beneficial. Avoid spicy and fatty foods by eating bland foods. You may be eating a diet of only crackers at this point, which is fine. It's not harmful. Your baby doesn't have a placenta yet, and it won't start taking nutrients from your daily diet until the second trimester. Also, for some, avoiding stimulating factors like strong odors, heat, humidity, noise, and flickering lights can help. Acupuncture and acupressure has been studied with conflicting results, but in most studies, they report a benefit. So consider trying C-bands or making an appointment with an acupuncturist. Ginger has been helpful for some. You can cut up tiny little pieces of raw ginger and stick it between your cheek and gum, or try ginger chew candies or ginger tea. Typically, ginger ale is not as helpful because the ginger content is low. Try sucking on hard candies like Jolly Ranchers, peppermints, lemon drops, or even chewing gum. For some women, the supplemental iron in your prenatal vitamin may cause nausea. You'll figure it out after you take your prenatal vitamin, and if you notice an increase to nausea in the next 30 minutes, it's probably your vitamin. So you can try taking it at night so you can sleep through the nausea, or you can switch to a prenatal vitamin that doesn't include iron, like a gummy prenatal. Or you can take a break from your prenatal vitamin altogether and just take the folic acid or folate alone. Vitamin B6 3 times a day can be helpful. You can try a hard candy called Preggy Pops that includes vitamin B6 in it. This candy you can take up to 6 times a day. One of the best ways to reduce nausea is to take vitamin B6 with a sleep aid called Unisom. This combination has been studied and shown to be very beneficial and safe to use while pregnant. Now, the sleep aid will make you drowsy, so it's okay to break the 25 milligram tablet in half and take that during the daytime to reduce the side effect. Unfortunately, there isn't any way to take all nausea and vomiting away 100%, but we hope that you can find some ways to keep the majority of your food and fluids down during the day. Once you're an established patient with us, if you're still struggling, we want to know. We have other prescription remedies that might be beneficial. If you're experiencing any of these symptoms, we would like to know. Please call our office 24 hours a day. If it's after hours, press 2 to speak to our answering service, who will contact the on-call doctor who will call you back. If it's during business hours, you'll speak to our scheduler who will connect you with one of our nurses. Well, I hope you found this helpful, guiding you to find ways to decrease stress and the bothersome first trimester symptoms. We look forward to seeing you in the office at your next visit. Thank you.